Come here, come here, come here. Why you keep changing right answers to the wrong ones? So before this video is over, I'm going to save you points on your next nursing exam. Not with some study guide that I ain't got. Not with a cheat sheet that I ain't got. And definitely not with some magical NCLEX trick that I definitely don't have. I'm going to give you one simple question that can stop you from changing right answers into the wrong ones. And if you're anything like I was in nursing school, you already know exactly what I'm talking about. You read the question, you pick the right answer, and you feel real good about it. Then that brain, this thing starts acting up. It's like, wait, what if this one is the one? That answer seems too obvious. What if they trying to trick me? And before you know it, you change your answer, you submit the exam, and later realize the answer was right there in the entire time. Girl, boy, Linda, Larry, why do we do that? Because guess what? I did it too. More times than I care to admit. But I can't tell you how many questions I missed. Not because I didn't know the content, but because I talked myself right out of the correct answer. And if you've ever walked out of an exam replaying those questions in your head thinking, God damn, I knew that. I literally knew that. This video is for you. Because today we're talking about one of the biggest mistakes nursing students make, confusing doubt with evidence. And those are not the same. So let's talk about it. Imagine you get this question, okay? Your patient has an oxygen saturation of 84%, shortness of breath, and restlessness. But the question asks, what is the priority here? What is the priority action? Most students immediately know what's happening, right? Your brain sees low oxygen, breathing problem, priority issue, pattern recognized. You pick oxygen, done, correct. But then you do something, you keep reading, and you see another answer choice. Maybe it says notify the provider or assess the lung sounds. Y'all know about that AdPie, right? Or place the patient in high Fowler's position, and suddenly your brain turns into a Netflix detective documentary. You start investigating information that doesn't exist. Why? What if they are really asking this? What if I'm missing something? What if the NCLEX wants the harder answer? And now you're no longer answering the questions in front of you. You're answering questions you just made up. That's the problem. Most nursing students don't get these questions wrong. They don't lack knowledge. They simply stop trusting the clinical pattern. Let's say that again. They stop trusting the clinical pattern. And this is what ANI is recognizing. The pattern here is oxygenation. The question already told you everything you needed to know. Low oxygen saturation, restlessness, shortness of breath. But your brain recognizes the pattern immediately. And then homegirl called anxiety shows up and tries to renegotiate. And anxiety is a terrible test-taking partner. So here's the ANI framework I want you to start using today. I call it the evidence test. And it's one question, 3 seconds. That's it. Before you change any answer, ask yourself, what new evidence did I discover? Pause. Seriously, ask it. What new evidence did I discover? If the answer is none, don't change your answer. I'm going to say that again for the people in the back. Those students in the back that don't like to sit in the front. If you discovered no new evidence, don't change your answer. Because the stem, the base of the question, didn't change. The patient didn't change. The assessment findings didn't change. The only thing that changed was your confidence. And confidence is not evidence. Doubt is not evidence. Fear is not evidence. Panic is not evidence. The question is still the question. The patient is still the patient. Trust the pattern. Now, let me be clear. I ain't saying your first answer is always right. Sometimes you'll generally notice something you missed. Sometimes you'll reread the question and discover a clue that changes the clinical picture. That's evidence, y'all. That's a reason to reconsider. But that's different from, I don't know the answer. This is too easy. That's not clinical judgment. That's anxiety wearing scrubs. That's a lot of nursing students letting anxiety drive the bus. The goal is to become better at recognizing when you're responding to evidence and when you're responding to fear. Because nurses don't make decisions based on panic. They make decisions based on the information in front of us. That's clinical reason. That's clinical judgment. That's what NCLEX is testing. And that's exactly why ANI is all about. Okay, real quick. If this is already clicking for you, I've put together a free training where I break down pattern recognition framework that completely changes how I approach nursing school and NCLEX. The link is in the description. It's in the bio. It's free. Watch it. I think you'll see nursing differently afterwards. So here's your homework. Okay. The next time you're doing a practice question, the next time you're taking an exam, the next time your finger starts hovering over a different answer choice, stop. Ask, what evidence did I discover? If the answer is none, leave it alone. Trust the pattern. Trust the clinical picture. Trust your reasoning. Because nursing isn't about memorizing more, y'all. I keep saying that. It's about learning how to think. If this video helped you, hit that subscribe button, because every week we're talking clinical patterns, clinical thinking, clinical recognition, clinical judgment, as well as prioritization, and the things nursing students wish someone would have explained sooner. Okay, y'all, I am Tish, and around here, I'm your big sis in nursing. Welcome to Applied Nursing Intelligence, where nursing finally clicks. And I'll see you in the next video.